Dr. Mustafa.
Good morning, one and all. I'll be presenting study of fellow eye in unilateral pseudophakic patients with good visual acuity presenting to a tertiary care hospital in central India. Starting with a little background, as we all know, cataract is the most common cause of preventable blindness and moderate to severe visual impairment. Worldwide, the numbers are estimated to about 90 million and India around 27 million. And among people 50 years or more, cataract is responsible for about 66% of blindness in India. I'm quoting the study by National Blindness Survey, Ranger sir and Surat Sangam sir. As we know, cataract untreated causes for around 66% and of blindness, and severe visual impairment around 48%. Presence of cataract, it not only reduces the visual acuity in the cataractous eye, but also affects the visual function of the fellow eye by means of binocular inhibition. Specifically, contrast sensitivity is affected. And after cataract extraction of the fellow eye, the normal binocular summation and stereopsis are restored. So early fellow eye surgery is recommended. The purpose of this study was to evaluate the fellow cataractous eye and identify the factors that cause a delay in fellow eye cataract surgery uptake in unilateral pseudophakic patients with good vision. It was a cross-sectional study, observational, done from July 23 to June 25. We included patients more than 18 years and unilateral pseudophakic patients with a vision of 618 or better in the operated eye and having age-related cataract in the other eye. One-eyed patients or patients with BCVA less than 618 in the operated eye or having other comorbidities leading to diminution of vision except age-related senile cataract were excluded. We found out that these are the results. We found out that the mean age of the patients was around 62. However, the females in 70 to 79 age group were a bit more in number than males. In my study, the total number of females were around 53% and males were around 47%. Education level of the patients, most of the patients were educated up till secondary school or higher secondary school, with a proportion of females being illiterate or less educated were a bit more. Most of the patients that we encountered were either self-employed, females were homemakers, or had a service or self-declared job. Visual acuity in cataractous eye at presentation was less than 6 by 60 in up to 60% of the 62% of the patients. 12% of the patients presented with white mature cataract and 4% presented with hypermature cataract causing secondary glaucoma. The reasons for delay that we encountered were need not felt being the most common, specifically in males. However, the local reasons, citing seasonal preferences or no one to escort, was more in females. Only a few number of patients came to us upright with that a need is felt. This is the interval duration between both eye cataract surgery. We found out that the mean was roughly around 20 months. The median was 6 months. The peak was roughly bimodal. Majority of the patients got operated within 6 months to 1 year. And the other peak was the patient got operated after 1 to 5 years of duration. The discussion, unilateral pseudophakic patients with good vision are prone to delay in other eye cataract surgery. A sharp eye has to be kept on at-risk population, that is the females or the homemakers for maturing cataracts, and to avoid complications related to hypermaturity. The threshold for felt need is less. Some people come to us with other eye vision 6-9, some people come to us with hand movement vision. So the threshold for felt need is variable and is less for other eye cataract surgery. They can see with other eyes, so they come to us late. Health education and screening programs may be undertaken in community for early fellow eye cataract surgery. Thank you.
So your data showed that the patients were, majority were educated.
Yes, sir. We had a good number of patients were had done their secondary schooling, sir.
Yes. So despite that, there was a delay in the So how do you correlate? I mean, education has no importance?
Yes, sir. Education does not. The felt need does not correlate well much with the education.
Okay.
It's quite variable. Patients had 6/9 vision in other eye, still they wanted to get operated, and they had two of the patients had phakomorphic glaucoma, and still with hand movement vision, and that was the only thing why they had come to us with 6/9 vision in other eye. So that is very variable, sir.
And of these patients, did you encounter patients who landed up with the phacomorphic glaucomas?
Yes, sir. We had one patient with phakomorphic glaucoma and one with phacolytic glaucoma, sir. Two patients had complications, sir.
And they were counseled for?
They were counseled. Other eye cataract surgery was done. We had counseled that whenever in their family or in their surrounding for other eye early fellow eye cataract surgery as well, sir.
Okay, fine.
One very important point that you have highlighted, the reason why cataract surgery, the fellow eye cataract surgery is getting delayed, the need not filled.
Yes, sir.
Need not fell. So what do you think with this, the reason need not fell, it's so common in the context of eye, ophthalmic research, and when we see the various challenges. So what do you think, like, what should be we know that this is something behavior related. People don't believe, don't trust, okay, ye kaam chal jayega. So what do you think, I mean, how to solve this kind of the casual attitudes need not fill? You will say every time need not fills. Mujhe koi zaruri nahi hai. So what do you think, what should be that solution for this?
Sir, sequential cataract surgery is the norm. Immediate is we do not prefer a lot in India because of endophthalmitis risk. Delayed sequential cataract surgery is the norm. But how much delay from the first eye to the other eye cataract surgery varies in different populations. So when we encounter a patient where we know that she is at risk, she is a female, she is old age, she is uneducated, she might have other barriers. So at that very much time, we might offer her other eye cataract surgery at some reasonable interval. Catching when they reach it the first time. Once they've gone from the hospital after one eye cataract surgery, catching them then it would be a bit more difficult. Other thing would be, I feel, sir, screening programs for cataract and other eye, and because the need not felt, people requiring binocular, very good vision are very not so much in number in the peripheral or the rural parts of India. One eye se dikh raha hai to dil ki kaam chal
So
raha
what
hai.
is the solution for that? You'll find so many patients, I don't need it, need not fills. So how do you tackle it? My
So
question is how
when
to
they
tackle
come to us for one eye cataract surgery, we counsel them for the other eye surgery as well. Or once they come, this is when they come to us. Or otherwise, we can go to them in the screening program, and then we can detect the unilateral pseudophakia. The percentage is around 9%, and then we can catch them in.
My question is, whether science matter in this context? The science, you have a science, so whether science matter or not, or something related to the cultural Indian context, social belief. So we need to think about the balance. So whenever, the answer comes, need not fail. So what I feel is science, should stay behind and think about the cultural aspects. So we think that, okay, one eye is still cataract is there, then you should come, they will not believe it. So in this context, my belief is science should behind and think about the local and cultural
Local
belief,
reasons,
traditional thing. Okay, that's
Yes.
my
Thank you, sir.
question. Okay.